Ready? So welcome everyone to the one of the afternoon sessions where we have a track keynote at the RegMed Capital Conference, part of the 11th Annual World Stem Cell Summit. My name is Bernard Siegel, the Executive Director of the Genetics Policy Institute and Regenerative Medicine Foundation, which is the producer of the event. It's really a special moment in the conference because we have a speaker that I met over the phone a few months ago. Someone pointed out, I think it was Chris Fair, that you have to talk to Ross Mason. And Ross Mason is the former chairman of the Healthcare Institute for National Renewal and Innovation, HINRI is the acronym, a venture philanthropist focused on making Georgia a national and global leader in health innovation. Ross is originally from Madison, and he became passionate about healthcare after volunteering at an AIDS hospital in Zambia the summer of 1999. In 2004, he created the Healthcare Institute for National Renewal and Innovation, which is a venture philanthropy that works with portfolio partners to serve the indigent, the uninsured, autistic children, wounded warriors and their families, with the Family and Warrior Support Team of the Joint Chief of Staff, victims of sex trafficking, as a part of the national pilot with the Obama White House, and institutions that protect human rights. Ross is the former chairman of the Department of Community Health Board, with an $11.2 billion budget, 660,000 covered lives, the third largest health plan in the United States. Former chairman of the Metro Atlanta United Way, and on, by the way, I could go on, but I won't, because I just want to summarize that Ross has had a life experience just about unlike anyone that I encountered. And in the Atlanta community especially, he has inspired so many people with this story. Well, what really triggered in me as part of our community is that venture philanthropy at this point in time is not only a red hot topic, it's something that can really change the way we commercialize life-saving products. It's a leap beyond anything that we've had before, and it's in the United States, it's now. And Ross is a champion of this. Our audience, the audience that's looking for innovative therapies to cure chronic disease, needs to listen to this message. And it's the goal of the World Stem Cell Summit to present novel ideas and to make venture philanthropy a topic that not only will be at this Atlanta World Stem Cell Summit, but every summit moving forward. So let me introduce my new friend, Ross Mason.
Thank you, Dr. Chair. Thank you. It's a pleasure to be with you today. Thank you. And I'll speak for about 35 minutes and then open it up for questions. There are a number of people that make my work possible. A lot of them are in this room. Tracy Anderson and Vivex, Tim Gainey, my sister Holly, and their team, and they have been a sponsor and a partner of my work for the last 8 years, and I want to thank them for making a lot of the things I'm going to talk to you about possible. I have a dear friend that spoke last night, and it is, I think his CEO just did a presentation, Pete Petit with MiMedx. He's also a sponsor of HINRI in our work, and you'll hear from what we talk about. We don't raise money. And you might think, what is venture philanthropy? Why in the world would it be relevant to me in my work in regenerative medicine with stem cells? It is very relevant. U.S. billionaires, because of the Buffett-Gates challenge, are going to give away $600 billion in the next generation. $200 billion of that is going to healthcare, which is a huge investment. That does not include the announcement you may have seen recently with Mark Zuckerberg, who just pledged 99% of his Facebook stock to social enterprise and venture philanthropy, basically. So it is a huge trend that's going to affect the future of science, the future of research, and how to have an impact in a scalable and a sustainable way. I think the traditional model of philanthropy is changing dramatically, and how the millennials and the techno-philanthropists, the billionaires in Silicon Valley and elsewhere are going to invest. And I'll just give you one example, not to pick on the American Red Cross, because we all love it. We're in Atlanta, obviously, and Coca-Cola is the most recognized brand in the world. Actually, the second most recognized brand in the world is the American Red Cross, which has done incredible work for decades all over the world. But they made a big commitment to building houses in Haiti 5 years ago, and they've raised tens of millions of dollars to do it. Does anybody have any idea how many houses the Red Cross has built in Haiti over the last 5 years? I don't know if any of you. 6. 6 houses. With one of our partners with HINRI, who started his organization called New Charity Story on June 1st, 2015, as a startup. He built 142 houses in Haiti in 3.5 months for less than $750,000. So that's the sort of thing I'm talking about. So as Bernie mentioned, I'll back up a little bit and tell you about HINRI, and then I want to tell you sort of at the end of my remarks about an initiative I'm working on with the Cathy family and others, and a multi-billion-dollar family in Texas. The Cathy family, for those of you who aren't from Georgia, they are the founders of Chick-fil-A, which will break through $10 billion in sales by 2019. They made a $400 million investment here in Georgia to bring Pinewood Studios to Georgia, which does all the James Bond and Harry Potter films, if you've seen some of those, I'm sure. Headquartered in London, they looked for a U.S. Location for over a decade. And the Cathys came to me about 6 months ago through their family office, and they are certainly a multi-billion-dollar family, and they said, we want to invest $250 million to fundamentally transform healthcare. Chronic disease in the United States, that's where we want to start, and the leading causes of mortality and morbidity around the world. How should we do that? So there are more and more people, whether it's Zuckerberg, people here like the Cathys. We have a billionaire that just generated $2.5 billion of net worth in 20 months in Texas, who's committed to give away 40% of his net worth already. So he's already got $400 million that he's setting aside, and he's looking at how do I have the greatest impact. So this is, there are traditional sources of funding like the NIH or HHS or other areas. There are grants. We all know high net worth individuals, but there's a new model, and I think our journey is indicative with HINRI that illustrates that, about how philanthropy is going to be, how high net worth individuals are going to engage in philanthropy in the future, and how that's going to have an impact on the kind of work you're doing. So I'll back up and give you a little history about HINRI and my work, and then how I think this is going to be changing going forward, and how it might impact your research or activities. And I'd love to have that conversation with you after I've made some initial remarks to sort of prime the pump on, or initiate your thinking. So HINRI, as he mentioned, my sister and I visited some friends in Africa, and they'd set up a hospital. 82% of the patients had AIDS, and they had almost no resources. And we looked outside, and there are all these campfires, and I said to one of the nurses, who I found out later was raising 22 children, and none of them were her children. They were all family members, but it was all of her siblings and cousins who died of HIV, who died of AIDS. And she's raising them in this one-room, dirt floor shack. And it was incredibly moving. And I said to the doctor, what are these campfires? And he said, oh, that's the patients who walked 150 to 250 miles to get care. That's their relatives who came with them and are killing game and roasting it so they have something to eat. Just really sort of an eye-opening experience. And so I created HINRI to kind of combine that experience, that compassion, love, and community with the drive, innovation, and entrepreneurship of Silicon Valley. After I had a real estate business in Russia for 12 years, I had a brief career on Wall Street as a private banker in New York and in the former Soviet Union. Spent 5 years in Silicon Valley, which really was transformative. I had a mentor who did 423 angel deals in 5 years, and 50% of his follow-on was from Sequoia, 30% by Kleiner Perkins, 10% Excel, 10% another 50 VCs. He and his two partners were the first money into Google, PayPal, Ask Jeeves, OpenTable, Red Envelope, LinkedIn, Twitter, Groupon, Facebook, etc. Very innovative. It was a very exciting group to collaborate with. So I wanted to create HINRI to sort of combine the compassion, loving community I experienced in that, visiting that hospital, with the drive, innovation, entrepreneurship of Silicon Valley. And I really, there were two or three sort of guiding principles. Number one, we wanted to solve really big problems. I mentioned that Sequoia was 50% of the follow-on. They had one investment criteria at Sequoia, which if you've seen the movie Steve Jobs, Mark Markolo was Sequoia. They were the group that did Apple among many others. They had one investment criteria, and that is it must be big. If personal computing, if the internet, if mobile apps are the future, and we're betting on the right spaces, we're going to move the needle. We're going to change the world. And the second was in my work, and I do a lot of work on both sides of the aisle, but in this case, I was a senior fellow at Newt Gingrich's Center for Health Transformation, and Newt's absolutely fascinating. He's really fun to read around. I also do a lot of work with Senator Cleland, who's a Democrat, triple amputee. He mentioned our work with the White House. So we're working with both sides of the aisle. But Newt engaged Jim Clifton at Gallup, and he asked the question, how many innovators drive the U.S. economy? Which is an interesting thing to think about, arguably the most powerful economy in the history of the world. And the answer that Gallup came back with, rightly or wrongly, was 3,000 people drive the U.S. economy. And if you think about Atlanta, where you are today, and I said to you I was going to remove 4 people when they were 20 years old and move them somewhere else, pick the city. If I were to take away Robert Woodruff, the founder of Coca-Cola, who's the reason the CDC is here, saved Grady Hospital, obviously Coca-Cola, Emory University, the largest gift ever given by a private individual in history to that point, he gave to Emory. Martin Luther King Jr., Ted Turner, the founder of CNN, and Bernie Marcus, the founder of Home Depot. If I just removed those 4 people from Atlanta, Georgia would be a third world country from a demographic standpoint. So what we decided we wanted to do is we want to solve really big problems with leading innovators. And when I moved back from California, the governor appointed me to the state health board, and that really gave me insight into how important ecosystems are for innovation. Wherever you're doing your research, building your company, the people that you're doing it with, the investors, the board members, the customers, that ecosystem is really important. An ecosystem is critical to innovation in healthcare. So when the governor appointed me 10 years ago to our state health board in Georgia, I went and met with the commissioner. Our budget was $13.2 billion, and they had not produced a financial statement in 2.5 years. So as soon as I went and asked him, I said, I've looked online. He said, I can't find any financial statements. He said, that's because we haven't produced one in 2.5 years, which to me sounded like a one-way ticket to jail, which would be nice now as a quad, free room and board and nursing care, but it wasn't so enticing then before I was injured. And I started looking at Georgia as an ecosystem. We have 159 counties. 57 of them didn't have a doctor. 67 didn't have a primary care physician. 88 had third world healthcare demographics. We led the nation in the percentage of our population with TB and AIDS. We are number 1 in cancer mortality, number 2 in childhood obesity. We have the 3rd highest high school dropout rate in America. Number 1, the percentage of our population, the political governor and people, they love it when I give these statistics. No, don't you want to move to Atlanta now? Number 1 in the percentage of our population that was under correctional control. 1 out of 13 Georgians is in prison or on parole. And we're in the bottom 5 in every death from every chronic disease. So, I mean, just absolutely where you want to be for great health outcomes for yourself and your family. And as we looked at the 660,000 people in the state health benefit plan that Bernie mentioned, 25% had diabetes, 43% were obese, and 62% had 1 or more chronic diseases. So, I mean, you look at that, it's just a demographic time bomb and disaster. And so we started thinking about how do we fundamentally transform the ecosystem. And I think that's very relevant as I think about it on this side of the patient equation from a stem cell standpoint, I was injured about 8 years ago, and there was all this promising conversation about the future of stem cells and how that would impact someone like me. I was training for an Ironman, and I had an accident. I got a bee in my helmet, and went off when it stung me, and I was and broke my neck, and went to Grady, then to the Shepherd Center, and there was a lot of conversation about the future of healthcare and opportunity for innovation, but it really was not a reality. And there were less than about 500 clinical trials, I think, going on in the United States at that time. Now there are over 9,000. And so as we approach a tipping point with stem cells and regenerative medicine, I mean, it's real nice to have water at 150 degrees or 200 degrees or 211 degrees, but you don't turn it into steam until you hit 212 degrees, and then you can do a lot of exciting things with engines and other things that aren't possible. So how do we hit that tipping point? How do you create those ecosystems? How do you drive that kind of innovation? So I'm going to share with you some of our journey with HINRI, and maybe some of that will be instructive with some of the issues you're facing, and then we can discuss it. So we decided we wanted to solve big problems with innovators, and Bill Gates, they're going to give away about $65 billion, and we really built our model around the Gates Foundation. A friend of mine named Bill Foege, I don't know if anybody's ever heard of Bill Foege, but Bill Foege was the director of the CDC when Carter was president. He was the first director of the Carter Center, and he convinced Bill and Melinda Gates to get into healthcare, and ended up eliminating smallpox. The first time we've ever done that in human history. Recently won the Presidential Medal of Freedom for his work. So we sort of created our model. We created a 10-step model on collaboration based on what Bill Foege was able to do to get people to work together. The World Health Organization was trying to solve smallpox. UNICEF was trying to solve smallpox, but they weren't collaborating. And from a purely financial standpoint, why should they? You're going to give me $30 million every year to talk about smallpox, and it really was the Gates Foundation, the Rockefeller Foundation driving the collaboration, bringing in the resources and making them focus on solving the problem with deliverables, milestones, and consequences that really caused smallpox to be addressed. So Bill Gates made the comment, the two biggest challenges in healthcare are a lack of innovation and a lack of access to the solutions that innovation creates. You're on the innovation side. We started on the access side. So what we did was we said we want to really clearly define the problem statement, and that's one of the challenges in a lot of the work you're doing with stem cells. But we have the luxury of looking at big problems and really clearly defining those problems and then articulating what success looks like. So our first problem we wanted to address was that access issue. We've done it in Africa since, but we started in Georgia. 1.7 million uninsured Georgians. So we said, okay, our goal is we want to provide care, charitable care, free or $5 or $10 a visit to 1 million Georgians, save $1 billion a year to our healthcare system in every county, all 159 Georgia counties. So we raised $600,000, put an organization together, put a board together, started with 5 faith-based clinics serving 6 counties. There are a whole bunch of laws we had to change. It was illegal then in Georgia to provide free care as a retired physician without medical malpractice insurance. We had to go after the trial lawyers to get that changed. We eventually just said, sue us, the State Health Board. We have a bigger balance sheet. So last year we had 105 clinics that provided free care to 325,000 Georgians and saved the state $420 million. And we've done that on a budget of $150,000 a year. We just had a donor who's come in to do $2 million, and I'm confident we'll meet our objective of serving 1 million, saving $1 billion in every county in the next 24 months. So that was our first problem. Our second was autism. 1 out of 88 children born on the autistic spectrum at the time. It's much more than that now. We raised $2 million, and we created a digital platform with a partner, a real innovator. And so when we identify these problems, we either partner with an innovator in the ecosystem, recruit an innovator, create an organization, or create a coalition to address the problem. So in the first one, we created a coalition. With autism, we partnered with an innovator. We helped them raise several $1 million, create a campus. We've now worked with in over 40 states with more than 20,000 teachers and 1,000 families on 5 continents, and we're in discussions with Harvard Medical School and the Swiss government about opening a $10 million center in Switzerland that would be an international training center for addressing autism in an incredibly innovative and powerful way. Our third problem was military reintegration and suicides, and we worked directly with the chairman's office of the Joint Chiefs. And we started, the suicide rate was 58 attempts a day among U.S. veterans, 22 are successful. A divorce rate of 68% for one deployment, 81 for two, 93% for three or more deployments. We did a survey of 4,400 military families in Georgia, 11 military bases here, huge impact on our economy, and a huge innovator in healthcare. That's where blood transfusions, penicillin, antibiotics came from. So what they told us, these families, they said we want a safe environment to decompress from the stress of combat and re-engage with our family before we try to re-enter society. So we partnered with Bo Calloway, who was the 11th Secretary of the Army in West Georgia, and we created these camps and retreats. We work with hundreds, now thousands of families to help them reintegrate. Then we realized that vocational challenges were more the problem, so now we're partnering with USPGA and Jack Nicklaus on vocational programs. We're doing manufacturing with the United States military and selling products that are creating jobs for wounded and disabled veterans. And we have 2 events a year that fund those activities. So that was our third project. Fourth was human rights. And there are 27 million people in slavery, about 6.5 million in sexual slavery. As he mentioned, we got a call from the Obama White House to try to figure out how do you address that kind of a challenge, that kind of a problem. And so we partnered with an innovator who's established 6 centers around the world for human rights abuses, working with the British Royal Family and Parliament, the South Korean Supreme Court and Diplomatic Corps on human rights abuses based on communism in North Korea and China, and then on radical Islam terrorism in Europe. We are focused on trafficking in the United States. Andrew Young chairs it. We did a series of national documentaries. We're in every 10th grade classroom in Georgia. And then we started doing international work in Africa. We have a partner with 64 clinics in Kenya, 75 in Ghana, 84 in Rwanda. And it's $2 a visit. They focus on the 6 leading causes of death. And they 15% are charitable, 85% are paid. And they create jobs and sustainability. And we're running, we're providing clean water through our partners to almost 10 million people. We're trying to feed 1 million of the 3.1 million children that starve every year in a sustainable way. And so we first, like in Georgia, drove access. So in Georgia, we created that network. Now that we're working with over 325,000 people, we're partnering with organizations like Apple that have a technology that you can read blood with your cell phone without pricking your skin to monitor your diabetes. In Africa, an example of the innovation, we have a partner that has a technology that can turn any vaccine or antiviral into a solid. So it eliminates the need for a cold chain. We deliver it with a sugar needle. You can only use it one time for that specific purpose. So if you pilfer the needle, you can't use it for heroin. You can use it for that measles, mumps, or rubella that's frozen in there. And then we coat it with magnesium to do time release. So we can give you the dose, the booster today and the dose 8 weeks later. So those are some of the projects we're engaged in, but why is that relevant to you and the work that you're doing? Well, where we're moving, which I think is going to be very exciting for Georgia, and I hope very exciting for you, in that proposal that we created with sort of some of these projects as a track record, where we raise money, put boards together, as I said, introduce technology, introduce or strategic partners to accelerate the mission and objectives of nonprofits. I do the same thing in venture capital in my professional life. As we looked at that ecosystem, we realized that the CDC actually has no technology transfer or IP strategy. So imagine a situation, think about all that Stanford does in venture capital and the impact that Silicon Valley with their unique ecosystem has had on the world. The CDC, with 5,000 MDs and PhDs and $7 billion of research, is larger than the entire university system in the state of California. But there's no IP strategy. There's no technology strategy. I mean, think about what we did with the public-private partnerships of NASA in going to the moon and what that meant in computing, what that meant in innovation, what that meant in transforming science and the application of science to improve our lives. And then once the government really eliminated the public partnerships and we sort of institutionalized NASA, we haven't done much since. And now it's Elon Musk and it's Jeff Bezos and it's these billionaires that are making these breakthroughs in space science and technology. So I have been working with the chairman of Space Science and Technology in the United States Congress to create a technology transfer strategy for the CDC to harness that $7 billion of research, to partner with the private sector, and to do that on a health innovation campus environment where the royalties and licenses will be flowing back to the CDC Foundation. And we would create an ecosystem where we bring in a lot of these billionaire or multi-billionaire family offices where we are addressing chronic disease with new innovations, and we're addressing leading causes of mortality and morbidity in the third world. But I think it's also going to lead to a lot of innovations in your area of expertise and interest. So I'll quickly give you a story or two that I think illustrates what we're doing, and then we can have a conversation. I'd love to talk about or brainstorm or think about with you, kind of in an open discussion, how some of the principles we've been implementing with our partners could be effective in your work with your companies or with your research. But what we basically do, if I described our model, and I think this is really important from a patient standpoint and advocacy in the work that you're doing, we're trying to empower innovators. Have any of you guys ever heard of Etta Mae Budd? Has anybody ever? Well, Etta Mae Budd was at the University of Ohio just over 100 years ago, and there was she was a white young woman. Her father happened to be the president of the university, and there was a young African American man. That's not what they called each other then. Eating in the kitchen, and a teenager. And she took an interest in him and said, "Why don't you come eat with me?" Which was very scandalous, from a societal standpoint then. His name was George. And he had these drawings in his notebook of plants. And she said, "Are you interested in being an artist?" He said, "No, I'm interested in agricultural research, but I just don't know that I can get the education that I need to pursue my passion." And she said, "Let me talk to my dad and see what we can do to help," as she got to know him, very bright young man. That was George Washington Carver. And George Washington Carver had a 6-year-old whose father was also on the faculty, and took agricultural samples with him. And he got interested in agriculture. His name was HINRI. So HINRI developed this lifelong passion for agriculture because as a 6-year-old, he's going and taking these corn and wheat samples with George Washington Carver. That was Henry Wallace, who became Secretary of Agriculture and Vice President of the United States, who then met Herman Borlaug. And Herman Borlaug was doing research on crop-resistant corn and wheat. They were real concerned about overpopulation and massive death in India and China, other parts of the world from starvation. And he arranged for the Rockefeller Foundation to fund Norman Borlaug's work in Mexico City on corn-resistant on weather-resistant and rust-resistant corn and wheat. Norman Borlaug won the 1970 Nobel Peace Prize, the Presidential Medal of Freedom, and the Congressional Gold Medal, and was credited at that time with saving the lives of 1 billion people. And the point of that story, obviously, is, we are not, and some of you may be, Norman Borlaug. We're not Henry Wallace, we're not George Washington Carver, but what we want to do every day is get up and be Etta Mae Budd. You never know who you're sitting next to, and if you just show a little bit of kindness to help somebody realize their dream, the impact that's going to have. And that was really, and I'll kind of wrap up with this and then let's have a conversation. That was really driven home for me when I was a senior at the North Avenue Trade School here down the street, and that's Georgia Tech for the uninitiated. And I was writing a speech in my office. Every year the student body president speaks to the incoming freshmen. And I remember when I was there, they said, look to your left, look to your right in freshman orientation. 2 of you won't be here in 4 years. And I didn't really want to go there with my speech. And so I'm sitting there kind of praying, thinking about what I'm going to say. And I'm from Georgia. I'd gone to high school in Athens, and I had a friend of mine who was a doctor. And he knocked on my door in student government. He was in Augusta at the medical college, didn't tell me he was coming, just showed up, just knocked on the door. And I said, Judson, what are you doing here? And he said, let's go. And I said, where are we going? He said, we're going to Pan for Gold. He said, I've just finished my medical exams, and we're going to Pan for Gold. I said, what? And so we walk outside, and sure enough, he's got all these gold deposit maps, and he's decided we're going to drive up to Wanaka and Pan for Gold. And on the way, he sees this hitchhiker, and he locks down the car to pick her up. And I thought, I do not want, before I could say anything, she's in the car, but I did not want to pick up a hitchhiker with Judson, because the last time he picked up a hitchhiker, it turned out it was two women that got in his car at a Huddle House at 3:30 in the morning, who later turned out to be men, and forced him to take him to Connecticut at gunpoint. So I was not really excited about picking up a hitchhiker with Judson. And so this woman gets in our car, and her name is Lynn Jordan, and she's got all these cigarette burns on her arms, and she's lit up some sort of something that was just some sort of narcotics I was hanging out the side of the car. It was the foulest smelling stuff I've ever smelled in my life. And I don't know what possessed me to do it. I'd been a missionary all over the world, etc. And I just felt so compelled to talk to this woman about God's love for her. So I did. I told her, I just want you to know God loves you. I believe, and I talked to her about the sacrifice that I believe God had made for her to relationally spend the rest of his life with him, etc. And we stopped at the Long John Silver's to buy her a 6-piece fish dinner, and then dropped her off at the China Star Motel in Lawrenceville, and then headed up to Pan for Gold. And I forgot about the hitchhiker. So we're up digging up someone's yard in a thunderstorm, who's by a creek. All these, jawbreakers. And Judson acted like he struck it rich, with fool's gold and whatever. We're just soaked and drenched and muddy and nasty, and had a great time. And then we drive back to Atlanta, and I'm in a student house. I'm in this house we've rented with the rabbit ears, if you remember the black and white TVs, and the shag carpet, and a $20 couch from the Salvation Army. So we pop on just turn on the TV, and we're still nasty. And the first story on the news is there's been a fire in Lawrenceville at the China Star Motel. And 4 people had been injured, and 1 person died. And it was Lynn Jordan. It was the hitchhiker we had picked up 5.5 hours before. And I shared that with the freshmen. And I said, when I was in your seat, they told me, look to the left, look to your right. 2 of you won't be here in 4 years. Let me tell you something different. Look to your left, look to your right. It doesn't matter if you have a 4.0 or a 2.0, whether you graduate from Georgia Tech or somewhere else, whether you're student body president or homecoming queen, you fail out 3 times. The only thing that matters is the person to your left and the person to your right. They are an eternal child of the living God. And the impact that you have on their life is the only thing that's really going to matter in your time here at Georgia Tech. And I would share that with you as a patient going through the U.S. healthcare system, where we spent $3.2 trillion last year on healthcare. If that were a country, that would be the world's 6th largest economy. Yet the World Health Organization ranks us 37th in healthcare quality, and we are 28th in life expectancy. We're getting a horrible return on that investment. And having worked with doctors and experts from the leading institutions in the Western world, I can tell you that the compassion and the human side, we are not just physical beings. When in the U.S. healthcare system, if you can't kill it, cut it, or medicate it, they don't deal with it. But it's so critical from a patient standpoint. We are emotional, we're sentient, we're relational, beings, and I think addressing the health of the whole person is so critical. And I think the people that can combine the cutting edge science that you're engaged in with a sense of compassion and a focus on the needs of patients, those are the people that are going to change the world. When I interact in my venture capital life with companies all the time, and some of them have incredible solutions, but they're not solving problems that are relevant to patients. And I think so much of our research, which can be incredibly ego-driven and et cetera, it's not relevant. So I think many of you are doing research, many of you are in the commercial sector, but I would encourage you so strongly to engage with patients in the areas of problems that you're trying to solve and understand what the important issues are for them. First of all, if those patients give up mentally, emotionally, psychologically, it's over. Doesn't matter what your whiz-bang technology is. But second, I think they have problems and challenges that the research community and the marketplace doesn't even realize is a problem. People look at somebody like me in a wheelchair and they think, oh, well, you just walk again. Well, I mean, that'd be great, but I'd much rather go to the bathroom on my own, frankly. So, I mean, I think there's a lot of opportunity for engagement with the patient community in solving problems that are on the front lines from a patient standpoint. I think doing it in a compassionate way and doing it in a sustainable and scalable way. And we've really gone in our model, from begging bread to others to doing things where we generate with business partnerships, companies and enterprises that sustain research and other activity. I'll give you two quick examples. One, I met with a group of millennials, and I love their passion, and their commitment to changing the world and having an impact, who were trying to feed starving children. And 2/3 of children are going to have permanent mental and physical disabilities, and the other 1/3 will die. They're on the brink of starvation, the ones you see on a commercial. But these guys had developed a technology that would bring 85% of them back to full health. And so they were driving all over America after this incredible experience in Africa to raise money to do that in this 1971 Winnebago, which ended up blowing up at a pillar of flame on the Pacific Coast Highway. Wonderful video. They filmed the ashes, and one of them says to the other, "Do you think it'll still start?" It was fantastic. But what they decided, and they said, we can't do this for the rest of our lives. We can't, as much as we want to save who doesn't want to save starving children? And with you guys, who doesn't want cutting edge research for Parkinson's or stroke or spinal cord injury? But we can't sustain it. So what they did was create a peanut butter company with all natural peanut butter and honey. The first customer I introduced them to was $6.4 million in revenue. We're launching in every Target in the United States. We're going in hospital systems across the United States. We're in every Harris Teeter. We could feed hundreds of thousands of children with a peanut butter that costs 75 cents to $1 more than a traditional. It's won all kinds of taste tests, and it's driving that solution in a way that we could never do otherwise. I'll give you one other quick example. We have a billionaire in Texas that we're partnering with who's basically doing transfer fees on real estate. I won't go into the details, but on 77% of the properties in the United States, every time there's a sale, he gets 27 basis points. It's insane, the amount of net worth he's creating. He created $2.5 billion of net worth in 20 months. And he locked down this process patent. But he gives away 5% of his revenue to philanthropy. So we are partnering with him, with HINRI, we hope, we'll see, to give away the first $400 million. But those are the kinds of partnerships that are going to create sustainable, scalable solutions with enterprise, to me, that are the future of philanthropy and can have a tremendous impact on the research you're doing, on the companies you're engaged in, because it takes tremendous patience to do the kind of, to let something like stem cells. I mean, we invented the airplane in 1903, and nobody could see any use, but 1969 we're landing on the moon. So how do you create the sustainable, scalable partnerships to accelerate what you're doing? So I'd love to open it up and have a conversation maybe about that if that's of interest to you. But I hope I will kind of close my formal remarks by, we do a ton of work with Warm Springs, which, as you may know, is where the March of Dimes came from. The polio vaccine was 10 years after Roosevelt's death to the day. April 12th, 1945, he died at Warm Springs. April 12th, 1959. 55, Salk created the polio vaccine. One of my favorite comments is from Eleanor Roosevelt, who I'm a Republican, but I love Eleanor Roosevelt. She said, and it's on one of the front of the buildings at Warm Springs with the patients that we're working with in the military, "The future belongs to those who believe in the beauty of their dreams." So I commend you for the beauty of your dreams, the things you're doing to transform healthcare in this country, around the world. and I'm excited to be here today. Thank you.
We're going to open this up to questions, and you delivered, Ross, exactly the message that I wanted our audience to hear, and I was very personally moved by this as the founder of the World Stem Cell Summit 11 years ago. Part of it was because I attended the first science meeting, the ISSCR, the International Society for Stem Cell Research, as an advocate. And there was no way that a person with a layperson's knowledge of science could really understand what was going on in the conference. I had to speak to the scientists on the coffee breaks to get some understanding of what it was. And I just wanted to make one comment that really struck me about being able to create something for one person. And I alluded to that last night. He's not in this room. He's conducting a panel now. But it's a friend of mine by the name of Joe Riggs. And Joe was one of the original network of stem cell advocates online, as was myself, for a group called the Stem Cell Action Network. Just a bunch of people interested in stem cells and were passionate about it back in 2003. And I like to tell the story about Joe because he created something called the Student Society for Stem Cell Research, which was one student at the University of South Florida. And he gave it this lofty name. And we were trying to create a movement to support this field. Well, Joe went on. I remember I went with him to a Starbucks in Tampa and encouraged him to say, you're going to have many chapters around the country. I'm going to meet all these scientists, and you should come with me, and I'll introduce you. Well, sure enough, Joe went on, got his master's in bioinformatics at University of South Florida. In the meantime, in the spare time, created chapters all over the United States and the world, entirely grassroots the entire time. And it was just a special project of my organization. So every year I would get letters, I would write letters of recommendation to medical school, to law school, of this student network that Joe continued. And all he wanted to do was study these cells. Well, then I wrote a letter of recommendation for Joe to get into the PhD program at Virginia Commonwealth University in bioengineering. And about a year ago, Joe got his PhD studying stem cells and bioengineering at VCU. And now he's a postdoc at Harvard. And I like to say Joe came from a background as poor as a church mouse. But it didn't matter. And he has influenced just one person, so many lives, in talking about the field and bringing it. So I've witnessed myself the platform of the summit and bringing people together. And I'm so grateful that the group attended this lecture, that you've been able to provide some inspiration for, and I want to just suggest that you please stay and have a dialogue with Ross now and open it up on anything. I'm sure you'd be happy.
Sure,
to speak.
absolutely.
Thank you, Ross.
Thank you. Thanks for having me. Are there any questions? Yeah, yes, ma'am.
Or the cure or right that I'm fighting for. Like getting to those people, getting through the red tape, it seems to me like you've developed a process for doing that, and I would like some input on that because I've written them and I reach out to the people that I know them, but it's not working yet. And so maybe you could talk to that.
Yeah. I mean, in the course of my injury, like the person Bernie was talking about, I had no medical clinical background whatsoever. I was very fortunate in reaching out to people. And if you think about the world of stem cells and regenerative medicine and what the future is, it's very daunting. If there's a particular injury, disease, illness that you're confronting, I'll try to answer your question as best I can. Yeah.
I want to emphasize is reaching out to the researchers.
Yep.
That's been easy. They are super creative.
Okay.
The problem is reaching out to
Okay. People to actually fund the work.
Yeah.
Okay, all right. Well, I think, first of all, I'll tell you how we vet what we do, and I'll do that in a minute. But that's why I think when you have a problem creating these scalable, sustainable partnerships is so powerful. I mean, there were a lot of people that, I don't think anybody in this room would argue that 3.1 million children dying of malnutrition in Africa every year is a bad thing. I mean, we can all go, oh yeah, that's really bad. But but how are you going to solve that problem? So what they did was they had a technology, which in this case is like a Cliff Bar that would solve it. And what you're saying is you're seeing all these promising technologies or opportunities. What they did and where we're moving is they created a scalable, sustainable solution with a business or a business partnership that a percentage of revenue then funds that activity. And that's where we're really aggressively moving with our work with HINRI, because whether it's that real estate gentleman I mentioned in Texas with 400 million, et cetera, but what we had to do over time, it's taken a dozen years to have credibility to be in that conversation where we become an intermediary. And even when you do have the money, like nobody has infinite amounts, but like Gates and Buffett, the Gates Foundation funds 100 enterprises a year, 100,000 each, selects the top 20, puts $1 million in each of those. And they're really having trouble solving, problems like your situation or mine. But I think creating partnerships in community with sustainable enterprises is really where we're going to focus going forward. And I think it's an incredibly powerful way to fund research and to partner with innovators in a way that's scalable and sustainable. And that's absolutely what we're committed to doing. So, but it's hard in these orphan areas or people where, small numbers are affected, spinal cord's one of those, to create that kind of an impact. But that's how we're doing it, and I'll be happy to brainstorm with you about maybe how to do that with some of the researchers you're engaged with. Okay, great. This is great. I always end up with so much, a huge assignment whenever I make the mistake of opening my mouth in public. Is there any other questions? Yes, sir. Oh, hey, Todd. Yeah.
So I'm Todd McAllister from Cytograph. On the positive side, there's these hundreds of millions and tens of billions of dollars that are flowing in potentially to healthcare. On the negative side, if you look at our field, average time for a therapy to go from an academic cornerstone to a commercial product is over 25 years right now. So to me, it's a very difficult pitch, whether it's to a venture capitalist or a venture philanthropist, to come in and say, all right, put your money into academia. And in 30 short years, maybe it will have an impact. Or on the other end of the spectrum, to say, hey, put it into Cytograph. It's a for-profit entity, and I'm just trying to get rich so I can go stick my feet in the sand. So I don't see a middle ground.
I hope that works out, by the way.
Well, we'll see. You see I'm here and not in the Bahamas.
That's right.
But so what are your thoughts on where's the middle ground where the people in this room can make an appropriate presentation to the Bill Gates of the world or whomever and say, support this research, and in a timely manner will make an impact? How do you bridge that academia versus for-profit?
And I think, and you know a lot more about your field than I do, but it's not just stem cells or problem with stem cells. You look at the Valley of Death in pharma. Even, in fact, the Journal of the American Medical Association published a study that 17 years for best practice to become common practice in the U.S. healthcare system. Over 100,000 wrongful deaths in U.S. hospitals every year. So it's a very, very broken system. And honestly, what I think is a critical part of the solution, look at the innovation in Silicon Valley in the knowledge economy. And it's because bits and bytes are not regulated like atoms. I mean, that's really what it is. And so the honest answer from I hate to be really negative about whatever, but what we do in our innovative work is we take it, Europe's even better than the United States or China, we're taking it to other markets where we're doing clinical trials in other environments where the regulatory and reimbursement risks are not so onerous. The Valley will not do healthcare for the most part. They'll do healthcare IT in some cases, but they do not want to deal with that regulatory and reimbursement risk. And so I think from an ecosystem standpoint, you know, what we've got to do, people like me that are patient advocates or people like me that are engaged in venture philanthropy or others in venture capitalists, we've got to create beachheads where we're creating mechanisms so that innovation can occur and those gaps are being bridged. It's a case-by-case situation. We've seen it in a simplistic way. I mentioned it with our free clinics where we had to change laws so it wasn't illegal for doctors to provide free medical care. But I mean, there have to be mechanisms for clinical trials to happen in an innovative way, for research to be done in an innovative way, and for people to be able to take risks and be rewarded for those risks, where that big pharma and others aren't driving the regulatory environment to create, to take out competitors and drive innovation out of the marketplace. We are doing that on a case-by-case basis, and I'm happy to try to talk to you about it. Some of the work we're doing with Congress and the CDC, for instance, to try to free up innovation. But it's a huge problem in our system. Oh no, Dr. Gainey. Okay, yes ma'am.
Hi, I'm Wendy Weston from 5X Biomedical.
Uh-huh.
Why aren't the people that are responsible for the regulations at these meetings listening to this?
Yeah, I mean, I think it tends to be, not to pick on people from an age standpoint, but 25 to 32-year-old government bureaucrats who've had no experience. I mean, it is getting worse and worse and worse, as you guys see every day. I don't know. I think there's a combination of a couple different things. I think there's a big pharma and other big companies that hold back innovation. I mean, we just seen it in medical device where Stryker, Globus, Medtronic, the federal government wanted to mandate UDI for tracking all of the implants. So the big guys stopped it, with their lobbyists, created a solution, then rammed it through to try to shut everybody else down that couldn't come up with a solution. But I don't know how the regulatory environment, it's going to take an administration, it's going to take national leadership that really is focused on innovation, and I think that really is focused on fraud and abuse. I mean, we're over $130 billion a year in theft just in Medicaid and Medicare. So if you look at the amount of money we're wasting, I mean, you guys are frustrated, and rightly so, because of the regulatory burden, but you look at the pilferage, the waste, and the lack of innovation. But I think the short-term solution is a little bit of what I said with Todd. It's actually finding markets where you can do clinical trials in an innovative way, taking it outside of the U.S. and exploiting other markets first. I think that's the short-term solution, frankly, tragically.
Before the next question, just a comment. So FDA was in the building, and Dr. Robert Califf and Dr. Celia Witten from the FDA did provide some commentary at the first plenary session. So this was a long time coming. We've had FDA persons on the representatives on the summit platform before, but not this level of leadership. So we're moving in the right direction as an advocacy-driven organization.
And I think to follow on that, one of the most powerful things you can do, an advocacy organization like this, is bring your expertise into the regulatory environment so that people can make decisions with industry experts and not government bureaucrats that are disinterested. I mean, Louis Sullivan, former secretary of HHS, I was with him at a lunch today, Nobel Peace Prize winners, people that have retired from venture capital, medical experts, patient advocates. They have a little bit of it with the congressionally directed medical research program, but I think one of the most powerful things you could do through an organization like this is try to encourage legislation that's going to allow industry input in the regulatory process. I think that's an incredibly important next step. And I think Bernie and this group could be incredibly instrumental in the stem cell area in making that happen. Yes, Dr. Gainey. I know I'm going to need a translator to understand the question. You're going to bury me.
No, I'm just very impressed, by this Capital Conference segment of the meeting. And you talk about the impediment of the regulatory burden and how much cost it is. So how do you translate the empathy that you had from Ms. Jordan on your weight of gold? Yeah. And how do you make sure that the profits that are now used in a regulation are still able to give people activity and options to treatments?
Okay, so how do you, number one, bring empathy into a regulatory environment, I think. It really is important in community. I mean, think about, you guys, it's hard for us to imagine, but a good example of this to me is MAD, Mothers Against Drunk Driving. That used to be, and I'm not old enough to remember, but that was the most cavalier thing on the planet. Everybody was drinking, they were hopping in their car, they were whatever, and just slam, I ran over, so I think I might have hit some guy on the way. It was just, they were just did not take, but what it took was a few mothers who had lost their children to drunk driving, and it always takes 15 years to do anything meaningful. But it took 10 or 15 years of just absolutely refusing to take no for an answer that totally transformed DUI laws across the country, et cetera. And I think we need, and you guys are all engaged in the marketplace, whether it's your research or your activities, but that's why, to me, organizations like Bernie's are so important, defining the problem statement and defining what success looks like. With us, 1.7 million uninsured, we want to insure 1 million. And when you can clearly, and that's actually, and you've met Mir Imran, that's actually what Mir Imran says innovation is. He was the first angel investor in Google, his aggregate revenue is $300 billion. But what he says innovation is defining the problem in the right way. And so I think part of what can really constructively come out of this conference and others like it is where you really clearly define what the regulatory burdens are, what the reimbursement burdens are, and what is, as an industry, what's impeding you. Because when you deal with a typical congressperson, man or woman, they don't typically, what do we have, 3 doctors up there? They don't have your background and expertise. And so I think clearly defining the problem statement as a group, and I'd encourage you to do that through this, part of the exercise when you're getting all these thought leaders together, is what are the 3 to 5 biggest challenges you're facing as an industry that are regulatory risks, that are reimbursement risks, that are FDA issues, and then as a group articulating that, and then defining clearly and successfully what success looks like on the other side of that. And once you've done that, getting the funding is much easier and moving the needle is much easier. And then you move to the next 3 to 5 problems. But I think doing that in community is a really important part of the solution. We've done it in a small way with HINRI, 2 men and a dog, basically, and are able to do these things with ending trafficking or free clinics or autism or whatever. But it was because we really clearly defined the problem and then we articulated what success looked like and then brought people together in community to solve it. Mr. Anderson.
Are you ready for me, Ross?
Sir?
Are you ready for me, Ross?
I don't think so.
Okay.
Mr. Anderson, I feel like I'm in the middle of the Matrix.
Well, my name is...
Get him some sunglasses.
I've heard that a few times. My name is Tracy Anderson. I'm the CEO of IVEX Biomedical, and I wanted to echo Ross's comments. Bernie, great conference. I think it's very valuable. But one thing I'd like to talk to everyone about today is really just patience and the human element, the human cause, because if we're not doing great things for patients, we're not doing anything. Yeah. And that's our number one goal as from our company within. And I look at Ross, and I met him shortly after his injury, and I would like to tell everybody in the room, he didn't have any function of his arms right then at any time. And there's just so many things that have happened through this process. And we really wanted to make it a goal of our company to see him out of that wheelchair. And with any luck, we will. But I just encourage everyone in the room to think about patience and the human element, because if we don't do that first, we'll never have commercial success.
Thank you, Tracy. Absolutely. And that's the connection. That's the connection in Washington with a bureaucrat or whatever. We all have families. We're all people. We're all part of the human condition. And I think when you personalize it and when it is about an individual, Stalin used to say, one person's death is a tragedy, 1 million deaths is a statistic. And so when you do personalize it, people can relate to that, and it is incredibly powerful in creating transformation. I certainly can think very directly about what Christopher Reeve meant for people like me. People identified with him. He's an individual. 12,000 people are paralyzed a year. What do you do with that? But, Superman's in a wheelchair. It makes such a huge difference when you personalize things.
I was beginning in this field, I had an audience with Christopher Reeve, who agreed to allow us to tape a statement. This was 6 months before he passed away, for the United Nations that was wrestling with a treaty that would have banned a part of stem cell research, which was eventually derailed. He was the most gracious man, and he invited me to his house in Bedford, New York, right? And I brought a film crew up there, and he was in a really poor state, I thought at the time, but when the camera was on, you know, this energy came there, and that encounter, I was already evolved, I felt at that point, from just suing people for a living. But it was one of the most moving experiences of my life to be on a sofa 3 feet away and listen to that, and then we played this to the UN. It was very significant. Another question or comment, sir?
Quick comment. I'm a MD, PhD, and I've been in the trenches for 30 years doing research and taking care of patients. I'm a surgeon, and I've been treating, I'm a pediatric surgeon, so we take care of a lot of babies, and we see the power of stem cells and babies being able to heal things, and adults maybe wouldn't be able to heal. So I've always been impressed with the potential of cell therapies, and our goal, we started an association called the Alliance for the Advancement of Cellular Therapies. And the idea is just to kind of, along with Bernie's efforts, to increase the groundswell of opinion and pressure on the various regulatory agencies to make this, to basically get the laws off of my body. These are my cells. I should be able to use them to help myself. What we do in surgery all the time is just mobilize and stabilize so the body can heal itself. So it's just, we have to kind of get back to that basic philosophy. So I just wanted to, you know, in the point that was made is that when you're in the office with your patient and they've been to so many different doctors and there's nothing we can do for you.
Yep.
Okay, that's really depressing, but you have to sort of say, let's try something, right? And then we're basically forcing our fellow citizens offshore to find something in some country where they have no idea whether it's going to work or not, and we're not even learning any data from that. That's very, very depressing. It's just wasted time. But right now, medicine in the U.S. is fairly broken. We lost. We're all very timid. We're very risk averse. We're very concerned we're going to get our butts sued again for trying something. And there's also all the laws that sort of kind of adding to the death of common sense in our country, I think, as far as taking care of patients. So that's on the medical side. On the research side, there's a lot of really good researchers that are being trained, and the NIH is losing them because we don't have enough money to keep these people going. And I think a venture capitalist or a venture philanthropist should really sort of work on taking people that are good scientists and sort of developing a research farm team. Develop them from Class A ball to Class AA ball and sort of get them to the big leagues. Same thing with these therapies we're doing, cell therapies. We really have to invest in our people and not chase them offshore. I mean, there's no jobs for people right now.
Well, and
research.
I just to react to what you said, I mentioned the statistic of over 100,000 wrongful deaths in U.S. hospitals every year. How long would it take us to innovate and address issues in the airline industry if every time you turned on the news, every other night you saw that a 747 was hitting the tarmac and killing everybody on board? How long would it take us to innovate and to address? So you're right, as patients, as citizens, et cetera, we have to, you know, bring the transparency, the accountability, the metrics, et cetera. But there are initiatives that I'm excited about that are transforming ecosystems. We have one in Georgia with an orphan, had 8 foster care parents, lived under a bridge as a 14-year-old. Now he owns 22 healthcare companies with over $750 million in annual revenue. And the only time a politician listens to you is before they're elected. And so, you know, getting people like him engaged in the political process, which he's done very aggressively in Georgia, but he created something called patientsforfaircompensation.org that he's in the process of passing, which would fundamentally change the way we do liability and lawsuits, et cetera, because we're shackling physicians and systems to keep them from innovating by punishing them and creating these huge lawsuits. And he's created a way that tort reform and liability reform is a huge part of unshackling the innovation. That's what I was talking about a little bit with bits versus atoms. And I think, physicians and researchers are so busy, et cetera, they don't tend to engage like a big pharma is going to do with their lobbyists in creating, various and sundry large activities for politicians. But, there are people like this gentleman's name's Rick Jackson who are trying to fundamentally change the ecosystem like that frees up people to be innovative. And I think those kinds of solutions are really powerful and impactful. We see the same thing in our education system where we spend billions and we're not getting a return. But I'd encourage you to look at patientsforfaircompensation.org and engage with people like Rick Jackson that are changing the regulatory reimbursement environment and the liability issue. The liability issue is one of the biggest impediments to innovation. And companies that are trying to protect their market share and want to stop innovation and create that kind of a liability risk.
So if I might close the session
Sure.
with just one comment. Whenever someone asks me, well, should I attend the World Stem Cell Summit? I said, yes, it'll change your life forever. And I really believe that because I'm enthusiastic about this conference. And I think anyone who sat in this room and listened carefully to Ross Mason as a speaker, maybe it has changed your life forever. Now let's thank Ross for his presentation.
Thanks for having me.